Dr. Patel, where do you see the pandemic tonight in the United States, and what can we expect in the numbers as we move toward the weekend?
Thank you, Lawrence. I hope that the numbers do not increase as dramatically as some had predicted. I mean, we were thinking that anywhere from 40 to 60% of the country could be affected. So you can do the math there. But I will tell you that these numbers, 1,000 new cases alone in New York City today, that is just the tip of the iceberg. And a lot of it has to do, Lawrence, as you know, with the fact that we're actually testing people. So not only are we seeing them sick in hospitals, but you're seeing widespread testing starting to slowly ramp up. So I hate to try to limit just a number, but this is exponential. It's not linear. So we know this is going to go into the tens of thousands in a matter of days.
Let's listen to what Peter Alexander asked the president today about the way people are able to get tested, depending apparently on who they are.
How are non-symptomatic professional athletes getting tests while others are waiting in line and can't get them? Do the well-connected go to the front of the line?
Well, you'd have to ask them that question. I mean, I've read. No, I wouldn't say so, but perhaps that's been the story of life. That does happen on occasion.
It's certainly the story of Donald Trump's life. Dr. Wen, how does that happen?
Well, the testing issue and coronavirus in general unveils the systemic inequities in our healthcare system and more broadly in our society. I mean, I was talking to clinicians today who are trying to get their patients tested. These patients are not celebrities, they're not politicians, they're just normal people. And these are patients who have symptoms, who may even have exposures and known exposures to patients with coronavirus, but they just cannot get these tests. And it's extremely frustrating to be that patient or be the clinician, especially when you see that other people are able to get these tests. I mean, to be sure, we just need more testing broadly because we need it to direct clinical care, and we needed to figure out, as Dr. Patel was saying, what exactly is the extent of the disease in this country. If we don't know, then how are we able to plan? How can we anticipate and figure out the right public health measures to tackle this epidemic?